This will be a short presentation on the emergency endodontics protocol. The goals of this presentation include reviewing endodontic concepts, learn how to set up your operatory, and learn to make a proper diagnosis. Emergency treatment is treatment that's performed in the least traumatic and most efficient way. The severity of the symptoms dictate the aggressiveness of the treatment. For example, an emergency is a person that comes in and says, this pain has been keeping me up all night and it kills me. Urgencies are something a little bit different, but we're mainly going to see emergencies in this clinic. Urgencies are, for example, I'm going on a cruise tomorrow. And also, it's helpful to know that patients are always worried the pain will get worse in the future, and they're worried that over-the-counter analgesics will be ineffective. It's important to know the pulpal diagnosis because the diagnosis dictates the treatment. So these you will find in your operatory, periapical, and pulpal diagnoses. It's important to be familiar with the definitions. When there's pain, when there isn't pain, these types of variables, these affect your diagnosis. What is a pulpotomy? It's indicated when there's a diagnosis of symptomatic, irreversible pulpitis. This is the picture on the left. This can be caused by caries, large restorations, cracked tooth syndrome, or trauma. The goals include adequate removal of inflamed pulpal tissue. This would be done at the level of the orifice, as you can see in the picture on the left. There will be a prevention of bacterial penetration, and this is through a coronal seal. And this coronal seal is placed until definitive endodontic therapy can be performed. Pulpal debridement is the picture on the right. It's indicated when there's a diagnosis of necrotic pulps. The goals are chemomechanical instrumentation, placement of an intracanal medicament in the form of calcium hydroxide, and placing a coronal seal until definitive endodontic therapy can be achieved. Now I want to talk about the endodontic armamentarium. I know this is a busy slide, so I'm going to talk about each thing. This is how I would like all of the operatories to be set up before a patient is seated. On the side table, I'd like you to have endo ice, cotton pellets, cotton rolls, a basic kit. It may not look just like this. In fact, it will not, but have a basic kit. And if possible, apex locator with the lip clip and file clip. Also have protective glasses for the patient, saliva ejector, high-speed suction tip, surgical suction tip, and air water syringe. On your back counter, when possible, have anesthesia loaded. Also on the back counter is your rubber dam isolation. These are your rubber dam forceps, 2 rubber dams, rubber dam frame, hole punch, a scissor, your clamps. Then you'll have instruments for the endo treatment. Here you'll have a mirror. I would like you guys to use the mirror with the mirror handle that has measurements on it. To the left of this mirror is an Endo Explorer. It's a double-ended Endo Explorer DG16. Back here are your files. The files are in an endo ring. You may not have an endo ring. If you do, you can bring it. If you don't, there's a file holder, but I'd like you to have your files out and ready to go. In this cup is extra sodium hypochlorite. Right here are 3 syringes of sodium hypochlorite that are already loaded. On this wooden tongue depressor, at the tip of it is some RC prep. But all you should have out are these 2 because these are your main instruments you're going to use. Up here are cotton pellets. These cotton pellets have eugenol. The cotton pellets are just dampened. They shouldn't be soaking, but just dampened with eugenol. And in this cup is calcium hydroxide powder. You're going to use these instruments on the side table when your patient is first seated to do your testing. All right, now I'm going to talk about the phases of this emergency treatment, what I expect from you guys. In the first phase, you're going to ask the patient the chief complaint, what brings you in today? Also, what's the history of the present illness? These are things like onset, Duration, when did it start? What are the aggravating factors? Hot things, cold drinks, chewing? What are alleviating factors? On a scale from 1 to 10 or 0 to 10, how intense is your pain today? How would you describe it? Is it sharp? Is it throbbing? Is it achy? Is it dull? And is it spontaneous, intermittent, or constant? Also, in the first phase, I'd like you to take at least 2 PA radiographs with different angulations and 1 bite wing. Down here are examples of the different angulations. Now, in this picture, the one thing I would change is the patient should have eye protection. Worth noting is that the X-ray beam is not directly in line with the ring. You can move the beam distally or mesially if needed. Radiographs, they can be misleading. In this radiograph, you can see on the left tooth number 9 and tooth number 10. Upon testing, tooth number 10 was normal to vitality testing, but it looks like there's a radiolucency from 9 and 10. Post-op, what you can see is number 9 had root canal treatment. Only number 9 had root canal treatment. And lamina dura reformed on 9 and number 10. Number 10 never had treatment. Okay, so we don't treat radiographs because radiographs can be misleading. After the chief complaint and history of present illness, you will review the medical history and enter the medical conditions in the electronic health questionnaire form, go over the need for medical consultation, antibiotic prophylaxis, treatment modifications, any allergies. Also, a big one that's not written here is, has the patient had any difficulty getting numb in the past for dental treatment? This is an opportunity for them to open up to you, and you can see if they're an anxious patient. If they are, you can start making some modifications if need be. Moving on to the third phase, this is your clinical examination. I want you to do diagnostic testing and put your results in the endodontic exam form in Axiom. Okay, this includes your vitality, percussion, palpation, and periodontal probing. The thermal tests, cold test can be performed using endo ice with a cotton pellet. The heat test can be performed using a dry prophy cup, and electric pulp test is a pulp tester that utilizes an electric current to stimulate sensory nerves of the pulp. Okay, when you're doing cold testing, you can say something like this. I'm going to place a cold Q-tip on your tooth. Raise your left hand when you feel cold. Keep your hand up until the sensation goes away. If you don't feel anything, keep your hand down. I am measuring the reaction time and duration of your response. In step 1, you will isolate the teeth with cotton rolls. Suction the saliva, any excess saliva, and dry the teeth with air or gauze. Step 2, cotton pellet with college locking pliers. You'll grab the cotton pellet, which is right here, tilt the endo ice up and spray for 4 to 5 seconds between each test. Step 3, place the cold cotton pellet on the middle of the buccal surface of a normal tooth. Do not touch the gingiva. Remove the pellet once the patient raises his or her hand and wait for the sensation to go away before moving to the next tooth. In step 4, before going to the next tooth, endo ice again for 4 to 5 seconds. Place the cold pellet on the tooth adjacent to the tooth in question. All right, just a side note, for PFM crowns, you can test around the cervical collar. All right, in detail, diagnostic tests for periapical diagnosis. The percussion test will tell you about inflammation in the PDL. Palpation test, inflammation to the overlying periodontium. Periodontal probing is for prognosis and possible etiology. Here on the left, what you can see is multiple probings, and this probing is deeper than all of the rest. There's pulpal pathosis. On the picture on the right, you can see multiple probings One isolated probing depth is deeper than the rest. This is in the instance of a root fracture. In the fourth phase of treatment, you consult an endo resident whenever available or see the covering doctor. This is where you're going to go over emergency endodontic consent form after you've consulted with an endo resident or the covering doctor. When you're going over the consent form, this is when you discuss the finances with the patient. Okay, if the patient has agreed to pay, if not covered by the insurance, you present your case to faculty for start signature. This is what the consent form looks like. You find it in attachments. There's an emergency pulpal therapy consent form which needs to be signed. And also, if it's not already in the system, the general consent and agreement needs to be signed by the patient. This is what the emergency pulpal therapy consent form looks like. Okay, so going back to the fourth phase, after the faculty has signed the consent form, the emergency endodontic consent form, the patient can be anesthetized and then pay if needed. Okay. After the patient is paid and is anesthetized, I want you to place cold cotton pellet on the tooth to test for anesthesia. If the patient is numb, put the rubber dam isolation and then check in with a resident or faculty at this point. After that, I would like you to remove caries and then check in with a resident or faculty. Following that, access the pulp chamber and then check in with a resident or faculty. This is going to be a diagnostic case. It's an example just as practice. Okay, the patient comes in with a chief complaint saying there's a hole in my tooth, it throbs forever when I drink anything cold, and it's extremely painful when I bite down. Patient is pointing to tooth number 13. As you can see, tooth number 13 has this large cavity. Radiographically, this is pointing to tooth number 13. The testing shows number 8. 8 is a baseline known normal tooth. Okay, it's important to have a baseline tooth in all of your testing. A baseline tooth is a tooth that is normal across all tests. Number 13, which has the hole in it, does not have a response to cold. Normal to percussion and palpation. Number 14, however, is abnormal to cold, abnormal to palpation, and percussion. And let's go back to the chief complaint. There's a hole in my tooth. It throbs forever when I drink anything cold. And it's extremely painful when I bite down. Okay, a reference tooth is tooth number 3. This is a tooth that has the same enamel thickness as the tooth in question. Okay, number 14 is the problem tooth. Number 14 is abnormal to cold, percussion, and palpation. The diagnosis is symptomatic irreversible pulpitis and symptomatic apical periodontitis. As you see, the diagnostic testing that you have done points to number 14 reproducing the patient's chief complaint. And as you can see, the patient's perception is that number 13 is the problem tooth. The treatment for number 14 is pulpotomy with eugenol, cotton pellet. If time permits, pulpectomy with calcium hydroxide application. Treatment pearls. There are a few things that I want to go over that I often see that can be done differently. There are a few things that could be done differently, such as rubber dam placement. Oftentimes the rubber dam frame is below the rubber dam. It shouldn't be that way. The frame should be showing and the rubber dam is below the frame. Also, it's important to make sure that the rubber dam is not caught on the wings of the clamp. It should be underneath the rubber dam clamp as it is in this picture. The sodium hypochlorite syringes. Okay, tightly twist on the needle to avoid sodium hypochlorite dripping on the patient. This isn't your fault. The needles are loosely attached to the syringes, so make sure they're tightened. And also fill the syringe with irrigation. Make it ready for use. Rubber dam clamps. Use floss ligation technique around the rubber dam clamps. Okay, I cannot stress this enough. Have your operatories ready for use. That means instruments are out, handpieces are attached when possible, files, syringes, temporary material, medicaments, everything. Everything, and these pictures are in each operatory, okay? For attendance, in order to get credit, a discipline must be added before I can swipe. And what happens after emergency endodontic treatment? Well, give the post-operation instructions verbally and written. The patient can become a patient of the dental school. The emergency endodontic student can pick up patient. A screening appointment could be done, will be done, and a treatment plan is formulated. Now, if the case is deemed too difficult to be handled by undergrad student, it should be referred to graduate endodontic department. Okay, if you have any questions, don't be shy to ask myself. If you cannot ask me, you can ask a resident. When you're done doing your treatment, fill out the top of the grade sheet and leave this form in the bin next to my computer. Thank you.